started as a Band 2 support worker in 2001. I then trained here at UHS to be a pharmacy technician, joining the medicines management team as a Band 4 shortly after qualifying. I really enjoyed working in the team. I've watched it evolve over the years. So the pharmacists and pharmacy technicians have really good relationships, need each other to complete our job properly. We have a lot of respect for each other. I think without a pharmacist by my side, I wouldn't be able to do my job, and vice versa. So it's important that we work together to get the best outcome for the patients.
So I work in a team of around 10 specialist oncology pharmacists, and that is comprised of a mixture of Band 6 and Band 7 and Band 8A pharmacists. We are involved in coordinating the chemotherapy service to the whole of the hospital, both on an inpatient and an outpatient basis.
So I started back here in 2018 in September as a student. I finished my training back last year in September, and I'm now qualified Band 5 medicines management technician here. So on the oncology wards, I work mainly with the pharmacists, but also the wider MDT. So the doctors, the nurses, the physiotherapists, and the healthcare assistants, we all come together to make sure we provide the best patient care.
I've been a specialist pharmacist in nutrition support for over 15 years. My background is surgical pharmacy, and I came here over 5 years ago to develop myself as an advanced pharmacy practitioner, and also to have the opportunity to work in a tertiary centre where they manage patients on home parenteral nutrition.
One aspect I really enjoy about my work is that there are a lot of training opportunities available. In my role, I'm going to be doing checking, which will be the next training available, but there are also management training, quite a lot of different diverse training, and a supportive in-house training team as well. We have a good retention rate for staff, so there's a lot of progression from pharmacy support workers to pharmacy technicians who have been with the trust for many years, some more than 20 years. And obviously having a lot of training, a lot of experience developed over that time.
We have a great team who will support any member of staff, whatever level they are. If you're having problems with a prescription or anything, then we have the team fully behind us. I work in the home care team within the pharmacy department at Southampton General Hospital. At current, we have over 5,500 patients all receiving treatment within their homes.
So, as a research team, we do interact with different teams, teams within the hospital, so research teams, nurses, the PI, so principal investigators, our doctors, but also local labs and the full trust as a whole, but also with our sponsors that may be external companies. We do run a lot of specialties in trials at UHS, being advanced therapies, cancer, respiratory, ophthalmology, and others.
So before I came into this job as a pharmacy support worker, I'd never worked in a hospital before. I didn't know really what it was going to be like, but I felt so supported by everyone here, and they definitely give you enough time to sort of bring you up to what they're expecting you to do. It's a very supportive environment, and if you ever have any questions about anything within the department, there's always members of staff there available.
I've been working at UHS for the past 3 years, and I started off as a trainee and worked my way up. I'm now a senior clinical pharmacist within the team, and I'm really thankful to be working in such a supportive team with various specialties and various expertise. The favourite part of my role is that I get to deal with different queries every day. It could be paediatrics one day and elderly care the next. Keeps you on your toes if you're looking for something like that.
One of the things I like about my job is that I'm a really social person. I like to talk, sometimes too much, but there's a lot of different teams that I can work with. I can learn from them, they can learn from me. It keeps things challenging because obviously I can go into something I don't really know a huge amount about it, but then I would pick up information, I'll pick up things from the other teams, specialties, and I use that in my future practice, which I find really good. I like that sort of thing.
Over the 10 years that I've worked here, the team has dramatically increased in numbers and specialisms. There's been lots of development of the roles at lots of different levels, from assistant technical officers right up to the pharmacy technicians and the pharmacists themselves. And it's been an eventful 10 years that's been very rewarding.
But one of the things I like most about my profession is patient care. By establishing a rapport with consultants, junior doctors, nurses and other staff within the ward setting. The most rewarding part of the job is to watch the transition from being a student to a working professional. I really enjoy watching them develop, coming alongside them to support their development, to encourage them, to motivate them to become the best pharmacists they can ever be.